Okay, so this exercise video is all about talking about hinging. So we're looking at RDLs, deadlifts, primary movement of our hip when we're trying to bend down and pick something up, or if they're running, sprinting, primary movement that individuals have to learn for all walks of life. So I'm looking at an individual's isolated movements first. Do they have that hip movement availability? Can they flex the hip? Can it internally rotate? A combined motion that's required in order for somebody to be able to hinge. And I might test the strength in isolation, whether that's through an open chain movement like a quadruped hip extension or looking at bridge variations. So this video will be focused on cueing and external cues and constraints that we can use to help with training the hip hinge. So I might first, if someone's ever had experience with hip hinging or RDLs, I might ask them to just show me what they do on a normal basis. So when I'm looking at this, I'm gonna just say, hey, show me what your RDL looks like. I'm looking at, okay, how are they moving the whole body? How is their trunk moving? How are their hips moving? Are they hinging from the hips? Or is this a bit more of a spinal movement? Are they doing a lot with their knees? So taking a gross look at it, are they able to get their chest down to the floor? Are they able to get hips back during that motion? Okay, and asking them to do a few reps. Okay, and I might ask, what are you feeling during this movement? So as I'm cueing this for the first time, I'll simply use those cues of, hey, get your chest down to the floor, get your butt back. Okay. I'm looking for a soft knee bend where the knees are not translating forward nor backwards, and their hip can drive backwards towards the wall behind them. Typically we'll feel a stretch through the hips. Some things we might see is too much stretch in the hamstrings, not really feeling those glutes, maybe even a lot of quad movement or some back tightness. So what could be going on there? I'll be asking, okay, where is the position in your feet? Starting from the ground up, we want to have pressure through the whole foot, hopefully the midfoot, which is where we're going to drive most of our force from. Let's say some individuals a little bit more on their toes. I might want them to shift back to load in their hips a little bit more. Okay? That's going to allow you to stretch the back side and take pressure off the front structures that might be working hard. Okay. So very common thing we'll see is, okay, my hamstrings are really tight. It's all I'm feeling. Okay. So a couple things there that we might be feeling. We might be seeing an individual keep their knees a little bit too straight, and their hinge looks more like this. Okay. I'll just tell them, soften your knees a little bit. Okay, make sure that pressure is towards the back side of the foot. From there, we should take some slack off the hamstrings, start to feel a little bit more through the glutes. Okay. Another thing I'm looking at is a little higher up the chain is, what is the pelvis doing? Okay. We've been taught to create tension or keep the spine neutral when we're deadlifting. So a lot of times we'll see someone anteriorly tilt at the pelvis and really create an arch more than keeping a neutral spine, which is going to create more tension through your hamstrings when you're trying to hinge. And that's going to create more tightness here without having the length in the glutes that we're looking for. So what I'll often talk about is, okay, let me just have you keep a little bit tighter core or a shorter line from your lower ribs to your upper pelvis. What that's going to do is keep a little more neutral spine versus that overextended spine to allow more length through the hip muscles. Okay. We'll often see translation of those knees forward and back. They might have difficulty maintaining that knee position while they're trying to hinge, and it becomes a bit more of a squatty hinge, something like this. Okay. So for this, we can use external constraints to make sure that they're keeping those knees in position while we try to drive that motion from the hips. If someone's having too much time or they bias that knee forward position, I might say, hey, just try to keep your knees back a little bit, keep them stacked over your ankles, and really try to push your butt back to the wall behind you. That'll keep them from shifting to the front of their foot and really load the back sides of their hips. Okay. If they're still having trouble with that, I might make it into a game. Grab your phone, grab some tool, just say, hey, put it right here. Hey, don't touch my phone when you're going down. Okay? They're going to try to keep it far away. That's going to force them to load their hips a little bit more. Okay. Or we have that other problem where someone keeps shifting too far back and those knees continue to straighten as they're going down, usually leading to that more hamstring stretch and not allowing them to hinge as well as we want them to. So if they're not able to keep a forward movement from just simple verbal cueing, say, hey, your knees are going too far back, keep those knees a little bit more forward. We can use external constraints like a foam roller or a yoga block. So using a yoga block and a wall, or for us, we got a box here. I might have them pin that against the box or the wall and try to keep that foam roller attached to that box while you hinge down. It's going to force that soft knee bend and force you to keep that knee forward rather than pushing back and letting that yoga block drop. And they should start to feel a little bit more through their glutes while we're continuously getting that hamstring stretch. If they seem pretty adequate in a double leg hinge, we might move right into a single leg hinge. Oftentimes we're having someone deal with one hip problem and the other side's pretty good. Let's see how they can isolate that, one side versus the other. Okay. So for this, I'm starting into a kickstand position. Same cues, can you get your chest really far down low? Push that butt far back. In this position, I might ask them, okay, hey, can you lift your back foot and see if they can maintain balance? For a vast majority of people, you're gonna feel some glute work in that position. And that's where we're reassessing, okay, what are you feeling? Is it hamstring tightness? There's a lot of quad activation there. And that's where we can shift that weight back a little bit, soften or straighten that knee a little bit more to make sure that they are getting to that spot. Okay. Again, the further that chest is down towards the floor, the more stretch we'll be getting to the glute. So can they really get it down nice and low, lift that back foot, and maintain that equal pressure on their whole foot with this, with the glute lighting up. Okay. So another thing that we're looking at is what are the feet doing? Okay. For a hinge, we're often looking at a pattern that's similar to what the body is doing in the mid-stance phase of gait. In the mid-stance phase of gait, we're looking at foot pronation, tibial internal rotation, and the ability to drive force through that flat and supported foot. A common thing we'll see is patients starting to supinate, which is not going to allow them to efficiently drive force through that mid-stance phase or create a lot of force generation when they're trying to come back into that terminally extended position. So usually trying to verbalize this, hey, I want you to try to flatten your foot out. I want you to spread your toes. Sometimes can help allow them to grasp what we're trying to do with this movement. If someone continues to have difficulty with that, or they've continued to walk on the outside of their foot forever, or they're starting to have lateral line stress or discomforts, there's other ways we can use this to use tools to make sure that they can put pressure through the inside of their foot. I like using a towel roll, so we're bringing the floor up to them to make sure that they know where they're supposed to put pressure. So just using a little towel roll like 1 or 2 times, I really like this with a single leg, but you can do it with a double leg as well, and just folding up a couple sides. And I might roll this up, say let's put half your foot on this wedge or this towel. It's essentially just gonna allow them to have more pressure under that arch and that midfoot. So I'll have them, okay, let's stand halfway on this towel, perform a couple of hinges, and on the way up, I want you to drive through that towel, squish that towel down in order to rise. Push. Push. So by adding that towel, you can usually feel a little bit more flattening through the foot. We're often stressing the inside of the leg a little bit more. We're working that big adductor muscle, big part of what's generating force during a hinge and allowing us to distribute force generation through the entire chain. Okay. So let's say somebody's having a lot of difficulty with this. Maybe they've met some of the isolation criteria. They're doing some bridges, they're doing some quadruped hip extensions, and just having a little bit too difficult of a time finding the ability to hinge properly, either through an RDL or a single leg RDL. Let's take some steps out of this, and when we're standing, we're having to coordinate lots of joints through this movement. So isolating the hip hinge, we can bring it down to just a tall kneel hinge. It's going to quiet the noise. We're going to have a little bit less moving parts, and we're going to cue this the same way. Okay? Keep pressure through your knees. Try to drive your hip back as you let your chest fall forward. Push through the knees in order to drive up. Okay? This is a great isolated version in order to feel purely the hips without having to worry about the feet or the ankles. And we can do the same thing in a half kneeling position where we're focusing on one side. There are some limitations on if they have the ability to kneel or if they're having tightness in the opposite hip that prevents them from going further back. So just some things to consider when you're choosing an exercise to make sure that they're building up their control abilities. So one thing I like to do with this is add a band if they're still having trouble. So what the band's going to do is provide some facilitation into that position we're looking for. Anchor that thing down low, band right around the hips. We're letting that band pull you back. Still push through the ground in order to hinge those hips forward. It's facilitation into that hinge as well as some resistance out of that hinge that may give some more tactile feedback for someone to feel a certain area that we're going for. This variation can be used with standing versions as well if someone still has a difficult time in a standing position of allowing their hips to drop back. It's just helping them, assist them into those positions and giving a light resistance out of those positions. So now we're talking about adding weight. They've got this movement pattern down. They're able to control it, double leg or single leg, whatever variation you're doing. Simple initiation pattern is using a kettlebell. I like to start with a handcuff kettlebell, handcuff RDL. This is a great way to add a little bit of load while not really straining the upper half. And what I mean by that is as we bring this weight forward, there is going to be more tension through the spine. So whether this is initiating learning of a movement pattern or someone has back pain or a history of a back injury, this will allow them to comfortably add some load without putting too much tension in an area that they're still trying to navigate. Kettlebell behind the back, you're simply going to push this weight back behind you and stand up. Okay? Something that I missed introducing is using a wall too. A wall is a great tool to learn how or where you're trying to push that weight. With the handcuff RDL, it's going to be similar. You've got a weight that you're going to push backwards. But if we're utilizing this box in yoga block, just like a wall, I might have them stand maybe a foot away from that wall and use that as a target on where they're trying to get their butt. Okay? Once they've hit that target, they know they've gone the right distance. If they miss that target, then they might still keep with this squatty pattern. With the introduction of weight, you can still do the same thing. I've got a target behind me, trying to push that weight back until I've touched it. And I can't feel the yoga block, so I'm going to go there. So, as they've figured out the handcuff RDL, you might switch to maybe a trap style variation. Again, this is going to be a little bit less strenuous on the lower back if they're having difficulties or an old condition that they're dealing with, where you can start to work some load without having such a high load on the posterior chain. Trap bars work really well for this, so you can load heavy without putting that stress and strain, as well as moving into a more traditional kettlebell or barbell deadlift. Okay. So the world is your oyster with this. You can use different constraints for different reasons. All variations can be used in all stages. So maybe we've gotten through some isolated movements and you can start to add heavier loads and they might still want a little facilitation. Ideally, we're moving away from these constraints as soon as possible so that they can develop patterns that they're going to use while they're running, while they're lifting up their kids, playing at home, or sprinting on the field. And then we start to add load as much as we can, get them as strong as possible. So have fun with it. Use your constraints as needed. Assess the body well, look up and down the chain, and make sure that they're feeling and getting tired in the right places, and you'll see progress with your patients.